can also delay that recovery time a little bit more, because essentially you went through every aspect of labor, and then delivery ended up resulting in a C-section. So that can impact recovery time as well. So preparing for a C-section, and like I mentioned earlier, not everyone knows that they're going to be having a C-section, or not everyone has that scheduled C-section, but it is good to know that it could be a possibility. So typical things that, I like to educate my clients on is, and even honestly, C-section or vaginal delivery, it's great to have prepared meals ready, so frozen or just kind of ready to cook meals. Having someone to help for the first 1 to 2 weeks is also really ideal. So whether it's a partner, a family member, a doula, just someone that can help out and kind of take the load. Setting up your space. So ideally on the main level of your home where everything is accessible. So you're avoiding stairs, you're not having to ambulate too far. Everything is kind of within reach. And then having care and or activities for any other children prepared. So whether that's, having them stay with a grandparent, or, daycare, or just even having activities and stuff at the ready for them to do while you're recovering and healing, and then caring for the newborn. Ways your partner can help: driving home slowly, bringing the baby to you, bringing food to you, bringing water to you instead of you going to get all of those things. If you're going for walks, pushing the stroller, doing the lifting where possible, and emotional support. And a general healing timeline. So day one, typically women feel, for the most part, amazing. So usually because the anesthesia is still circulating, you're a bit swollen, you start to slowly begin ambulation. Day 3 hits and you're not feeling so good. So anesthesia has worn off, hormones are flooding in. You're dealing with life with a newborn. If you're breastfeeding, you're dealing with milk coming in. Incision pain really starts to set in at that time. And then usually by about week 1, you're now decreasing your pain medication to help with the pain. You're walking, but you are walking a little bit hunched over, again, just because of that incision pain. And by week 2, ideally, you're off the pain meds. You're getting around a lot easier. And then weeks 3 to 6, gradual improvements. You're feeling good. You may feel good enough to push it, but really don't. Really give your body that healing time, that time to really recover, even though you're feeling good. Just again, be respectful of your body and what it just went through, and give it the proper amount of time so that it doesn't end up delaying your recovery further out. And then, so kind of going along with that, some tips for after birth. So pain management, like I talked about, a lot of women do have pain with the incision. Stay on top of your pain meds. So most medications are actually quite safe while breastfeeding. I know that's a big concern. So just to give you guys an idea, ibuprofen, if you take, a typical 2 extra strength ibuprofen, so that's about an 800 milligram dose, 0.6% actually gets passed through in your colostrum. And then in your mature breast milk, 0.38% gets passed through. And that actually is the equivalent to a 0.2% of a pediatric dose. So if you look at it like that, yes, it is being passed through the breast milk, but at such a low dose that it wouldn't even amount to what an actual full pediatric dose would be. If any opioids have been prescribed early post-op, like codeine or tramadol, for that breakthrough pain in that first 4 days, the baby is typically monitored for signs of sedation, but typically it's shown to be totally fine. Early ambulation can start it can start as early as 6 hours post-op. So early ambulation actually helps with mood, depression, constipation, pain, strength, overall health, memory, sleep, hormone regulation, and circulation. So really trying to get moving as soon as possible. Transfers, so rolling, pushing up in bed and using a pillow to compress the incision site. Coughing and airway clearance techniques, so abdominal splinting. So what that refers to is, if you see that picture of the woman holding the pillow at her incision and over her stomach, so using that pillow to compress it while you're either transferring or coughing can really help with the pain. Coughing as well can cause a lot of strain on that incision site and can be quite uncomfortable. So teaching techniques such as huffing to kind of get the cough out is usually a good thing to practice and just kind of learn pre-delivery in case you need to use those techniques on the postpartum end. Now, again, I can't speak to my experience. I'm not too sure if the hospital staff, nurses, midwives, or whatnot do teach those huffing and splinting techniques. I do know, I have heard of some midwives doing that, which is awesome. But those are really important things to kind of know and be aware of. For bowel movements, stool softeners, toileting posture, hydration, fiber, all really important. We want to minimize any excess strain, any bearing down, anything like that. So anything to make it easier for that is ideal. And then some helpful aids, ab wrapping, high-waisted underwear so that things aren't kind of cutting in or irritating the incision site. A little note on the ab wrapping. So this is actually just a bit of a disclaimer too. This is actually more for the actual scar. This has nothing to do with ab separation or really getting the abs back together. This is just kind of for scar healing. It can begin immediately after birth. You can really wear it for the first 30 to 60 days postpartum, starting with a few hours at a time. Studies have shown that you should progress to wearing it all day and night except for when showering, but do not wear it too tightly. So you should be able to breathe comfortably and move unrestricted. And in terms of wrapping technique, these should be in the instructions, but always wrap from the bottom up and not the top down. And it has shown to improve pain. So in a 2010 study, it was shown that the use of something like the C-panty or an ab binder should be considered by clinicians for post-op management of pain for those undergoing major abdominal surgery. And a C-section is a major abdominal surgery. So it is something to keep in mind as a postpartum kind of recovery technique. So that 0 to 6 week postpartum time frame. So you're learning to live with a newborn. You're managing, breastfeeding schedules or feeding schedules. Really, really keep in mind that rest and recovery as best you can is critical. You want to maintain range of motion. So chest, back, especially if you are breastfeeding and bottle feeding, you really want to make sure that you've got your pecs stretching and you're not getting that rounded forward head posture, rounded shoulders. You want to try to maintain as best you can the strength of your glutes, your abs, and your pelvic floor. You want to, again, stay on top of your pain management. And in terms of actual exercise and physical fitness, so, from a cardiovascular perspective, you want low, moderate intensity, very low impact. So you're looking at about 5 to 30 minutes of walking. Ideally is just great. If you do want to bike or use the elliptical, no resistance. So keep that in mind. Again, really respecting your body and what it's just been through. Even though you may feel great, really don't push it in that 0 to 6 week time frame. And then in terms of strength and flexibility, at around that 2 to 3 week postpartum mark, you can start with some gentle whole body stretches, but again, no added resistance. So no TheraBands or nothing like that. Just very gentle stretching and range of motion. So, what does cleared for exercise mean? So, this is a very common thing, regardless of how the delivery goes, C-section or vaginal. Women go to their, 6-week postpartum check with their midwife or their OB, and they get the cleared for exercise. So, a lot of women are like, exactly what the slide says. What does that mean? So, what that should mean is that walking is great. Restorative core exercise, light resistance, body weight exercises. You're starting slow and you're easing into it. What cleared for exercise does not mean is that you're starting with or at your regular pre-pregnancy level of high impact, heavy lifting, running, or traditional ab exercises. So definitely know the difference. Even if you're feeling well enough to go back to doing exactly what you were doing pre-pregnancy, don't. Start slow, ease into it, and gradually week over week kind of build on what you have been doing the previous week. If there's any new or increased bleeding, spotting, or pelvic pain, it's likely your body's way of telling you that you're doing a little bit too much too soon. So that's an indication that you do need to kind of back off a little bit and then and take it a bit slower. So some common questions: when can I return? So when can I return to lifting? So gradually increasing starting at 6 weeks or when cleared by your surgeon. Swimming, so when your incision is fully closed, so 6 weeks or more. Strengthening, so bare minimum 6 weeks, and you're starting at 2 times a week for about 15 to 20 minutes. Very, very lightweight. Again, you're not going back to what you were doing pre-pregnancy, you're easing back into it. Sex, 6 weeks or when you feel comfortable. So again, that's another thing when OBs and midwives are like, yeah, you're clear, you can exercise, you can have sex. A lot of women just aren't feeling ready for it. So I always tell clients that, and it's easier said than done, but if and when you do decide that you're ready for sex, really try to be as into it on your end as possible. For sports, low impact, you want to be symptom free, and you're looking at about like 2 to 3 months postpartum at the earliest to get back into your low impact sports. And when I say symptom free, it means no pain, no discomfort, obviously no bleeding, no spotting, nothing like that. No irritation with the scar. And then running in high impact sports, the current guidelines right now are saying 3 to 4 months postpartum for that. But that is up for debate and it is currently being studied. But that's currently what the guidelines are saying. So it's common for women to feel lost in terms of how to return to exercise postpartum, like where to start, what to do. There are so many resources out there, and a lot of them are wonderful, but there's so many resources, so many workout programs that claim to be safe for postpartum. At Blueberry, we actually work really closely with Morgan, who's a certified trainer and owner of MK Fitness, where she creates personalized workout programs for women in her virtual mom and baby exercise program. So these are literally tailored to each woman specifically based on how far they are postpartum, what method of delivery they had, any pre-existing issues, injuries, anything like that. So it's tailored to you as an individual. Again, there are a lot of other resources out there and a lot of other, I know a lot of women do like Beachbody programs and stuff like that. It's just really important to know that, to know your limits and to not push those limits too far, because it could lead to longer term problems down the road. So some actual scar care. So at pretty much anywhere between 2 and 6 weeks postpartum, when your incision has actually fully closed, it's recommended that you massage it in all directions for about 5 to 10 minutes a day. So this slide does show some different techniques. So, up and down, pinch and lift, circles. Discomfort is okay, but there should be no intense pain. And it's perfectly normal to have an emotional response to touching the scar. So I just want to kind of go a little bit further into that point. Some patients I have seen get queasy when they either touch their scar or they think about touching their scar. Um, the most common thing is some women have said it gives them the EBGBs to really touch their own scar, or they have a very emotional response. So, if it was a traumatic delivery, if you were really upset by how everything panned out, there can be that emotional response where women just kind of want to dissociate from the scar, and they don't want to think about it. So it's common and very, very normal to have those things. It's totally normal to feel that way. For situations like this, I try to teach women some scar desensitization techniques. So what it usually starts off with is visualization. So some visualization techniques where I get them to visualize they themselves touching the scar, and then I have them visualize having someone else touch their scar. So whether that's their practitioner touching the scar or their partner, and then we progress from just the visualization to actually having the patient touch the scar, but with a barrier. So putting like a face cloth over top of the scar, and then having them then touch it with that over top of that face cloth, progressing from there to, again, with the barrier, the face cloth, but having a practitioner or a partner then touch it over the barrier. And then from that point, you kind of get to trying to get the patient to directly touch it themselves, and then having the practitioner directly touch it as well, or their partner as well. But some women go through the visualization and they just can't get to the point where they themselves feel comfortable touching it, but then they're okay with someone else touching it. So scar frictions and scar care is something that we do offer at Blueberry Therapy. We all do know the techniques to help kind of break up scar tissue and help with scar mobility. We also have two amazing massage therapists, Heather and Naomi, who are very well versed in scar massage technique. So that could also be an option where you don't have to book a massage just for the scar. You can have, a 45-minute hour massage, and then you can ask them, you can say, can you spend 10 to 15 minutes on the scar, and then they can incorporate it as well. It's something you can ask a current, if you have another massage therapist, you can ask if your own massage therapist is versed in the techniques as well, and that could be something that they incorporate as well. But at Blueberry, we do have Heather and Naomi who work a lot with scars as well. Yeah.
Oh, sorry. There's just a question for you.
Yeah.
In the chat. Just one of the women saying that she's never been told to massage.
Yeah.
And now at 9 months, is this a good time to start?
Great question. Whoops, sorry. Didn't mean to jump ahead. So yeah, that's a great question. And honestly, there's not a window of time where you kind of miss the oh my God, I'm 9 months postpartum, there's nothing I can do. We can always make change to the scar and to the tissue and just to the skin around it. What we do want to do is obviously break up scar tissue, limit any adhesions that may be built up, and just really make sure that all the skin around is moving appropriately. So great question, but no, and I have actually seen, and quite recently, some women that are in the further postpartum end, like around even the 1 year mark, that we are doing some scar work with them, and things are breaking up, and they're noticing some more mobility. Yeah. Chris, were there any other questions on that?
No, that was just the one. So
Okay.
that you answered it perfectly. Bottom line is it's never too late to start.
Yeah. Perfect. The other thing too with the scar frictions is I do find that it can, because if anyone's ever had a scar, nerves regenerate at their own time. There's no like set in stone. Your feeling and your sensation will come back at 9 months or 10 months. But the more you kind of work on the scar and the more you touch it, the blood flow and all of the properties that it kind of enhances, I do find women do tend to get their sensation back a lot quicker than maybe they would have had they not done any scar work. So that's an added bonus as well too. And then even with the redness. So some women find that the more you're working on the scar, the redness actually calms down and settles down, and it fades a lot quicker. I don't know if you found that, Kristen, as well in your.
Yeah, I yes, I exactly have found that. And then even some where they really are annoyed by kind of a pucker or anything like that, as soon as they start doing any kind of playing with the scar, that it helps to settle down. And it's a bit of an art. There's no wrong really way to do it, but to, if they're able to do some of it, it's very helpful for them.
Okay, so C-sections in the pelvic floor. Overall, so a study done in 2012 showed that overall, women that have a C-section do have less urinary and fecal incontinence, prolapse, less decrease in pelvic floor muscle strength in comparison to vaginal deliveries. However, there's a big however to this. It is still very important to watch for overactive pelvic floor muscles or hypertonic pelvic floor muscles. So those muscles kind of being overactive. Constipation issues, abdominal pain and strength, and sex pain. So just because someone has had a C-section does not necessarily mean that the pelvic floor has been spared. Just because baby did not come out vaginally does not mean that the muscles that you see in that slide have not been affected. Another interesting thing is, so the urinary incontinence, women who have had C-sections have less urinary incontinence only if all of their deliveries have been C-sections. So for anyone that's had a VBAC, you're still at risk of all of these issues as well. And just in terms of rates, just to give you an idea, so urinary incontinence rates for C-sections are 38 to 41%. So 38 to 41% of women who have had a C-section will still have some sort of urinary incontinence versus 54% of women who have had a vaginal delivery. So again, a little bit higher for vaginal deliveries. Women can suffer from urinary incontinence, but C-section deliveries do still have can still have issues with urinary incontinence despite baby actually not being delivered vaginally. In a study actually done in 2011, at 12 years postpartum, there was still a 40% prevalence of urinary incontinence, even if all of the deliveries were via C-section. So again, it's one of those in the early postpartum end, women who have had C-sections do tend to report less urinary and fecal incontinence, prolapse. Their pelvic floor muscle strength does tend to be a bit better than those who have had a vaginal delivery, but there are still issues. There can still be issues in the pelvic floor, overactivity being one of them, that can cause things like incontinence and sex pain and all of that. So I know I've treated women, I've assessed women, and they've had a C-section. And when I talk about having the internal, which is part of our pelvic health assessment, they're like, well, baby didn't come out vaginally, so do I really need to have my pelvic floor muscles checked? And that's where I'll explain. Obviously, it's always with your consent, but I'll say, your pelvic floor went through 40 weeks of pregnancy. The pelvic floor muscles have to work harder than they've ever had to work before, just throughout your pregnancy, to keep things up and in, and just, to make sure you're not leaking and all of that. And sometimes on the postpartum end, those muscles just aren't able to relax. They're not able to go back to their resting length. So Again, just because baby didn't necessarily come out vaginally doesn't mean that everything in the pelvic floor kind of stays as is. So it is still very important to kind of check in on the pelvic floor to see, is there any overactivity? Is there any issues with strength? Is there any prolapse despite someone having a C-section versus a vaginal delivery? So I actually got this quote from a colleague of mine who did a presentation, and I think she's doing our next presentation, Mia. So this was in one of her presentations, and I loved it, and I snagged it. So there's no superior or inferior way to give birth. There are only babies with individual circumstances and unique scenarios. There is only love, new life, and new beginnings, with individuals starting their lives as mothers and babies starting out in the world. So I just wanted to put that in because, again, a lot of women don't necessarily plan on having a C-section. And on top of dealing with delivery and hormones and a new baby and life with a new child, women can be very hard on themselves. They can start to, say things like their body wasn't able to do it. You can get really down and emotional about it and just feel like you weren't able to do what a woman was supposed to do because you've had a C-section. But honestly, again, as long as you're healthy, you're happy, baby's healthy, and baby's happy, know that um, there's supports out there, and we're here to help. So that is all that I have for the presentation, but I'd love to open it up to any questions or concerns, or if anyone wants to share any of their own personal experiences, I'd love to hear them. If you're not comfortable asking questions live on the platform, you can always email me. You can go to the website. You can call in. But yeah, Kristen and I would love to hear from you. That's about it. Thank you again.
Meg, that was really well done. You have another question in the chat line. Can scar massage help with puffiness in the lower abdominal area? And how does C-section recovery change if you've had your tubes tied at the same time?
Oh, that's actually a really great question. And I do not, I don't know if you do, Kristen, but I haven't come across anything in my education on C-sections about how recovery would change after also having tubes tied. There hasn't been anything that I've seen that would change that.
The only thing that I've had with here I can hang on. Right. The only thing that I have noted, and maybe I know Naomi's on the call too, in some women that have had their tubes tied, it's just a longer surgery.
Oh,
And a little bit more invasive because they need to be in there. So I've had women who where it took a wee bit longer to recover, but just in the early days, I
okay.
it was just because they were under a little bit more um oh my goodness, sorry, it's late. Anesthesia.
Okay.
And there's just a little bit more moving around of things in there as they get to the tubes and that kind of stuff. So a little bit more painy, bruisey feeling. But that's the only thing I've noticed.
Okay. And again, more in the early post-op versus like not necessarily extending like modifications or parameters for return to exercise and stuff like that.
That's right. And you've got a couple more questions. Does anyone get sick thinking about the actual surgery?
Um, not in my experience. No one's verbalized that, but I would assume that that's a common and very normal thing to have.
And nervousness. I had a conversation with a client not that long ago about, contemplating because of a prior difficult vaginal delivery, should they go through a C-section, and a little bit of the unknown and the things that might happen. It's a bit nerve-wracking, right? That you're thinking about surgery. And in that case, I chatted with this client about a tool called Your Choice. And that's a different discussion. But if you're trying to determine whether C-section or vaginal birth is the best case for you, there's a number of researchers that have put together a lot of data to show what happens to the pelvic floor based one or the other, and based on your specific history, your age, whether you've had a baby, whether you've had issues, and it gives you percentages of things that might occur afterwards in terms of pelvic floor. It's kind of an interesting tool. I can pop it the web page up into the chat line if you want to take a look at it afterwards.
Nice. And actually, I've had a few clients who, in dealing with kind of their own mental health and anxieties, they actually want to advocate for a C-section because the fear of the unknown, and they want like a scheduled C-section. Again, just for their own peace of mind, they want to know, okay, on this day I'm going in, I'm having the baby on this day, this way. And then for them to, from a calming perspective, that's been something that they've advocated for themselves.
And you have a couple other questions. Is there any difference in pain management on recovery with stitches versus staples?
Okay, so that would definitely be surgeon directed. Healing time is a bit longer for staples versus sutures. Now, in the most recent studies, and I can only Canada, speaking specifically in Canada, a lot of the surgeons are actually moving away from staples. The only time they're being used currently is on very obese women. So for them, they still have to use staples, but everyone else is moving away from staples and doing sutures. But actual kind of recovery and incision healing timeline does vary a little bit, and it would just be more directed by the surgeon on that end.
Another one. Thank you, Suzanne, for Brandy, mentioning that having tubes tied after a C-section and really not feeling that different. Thank you very much for contributing that. That's it's good to hear from a client perspective for sure.
Yeah, for sure.
Another question, what are some signs of adhesions to watch for? I'm 5 months post C-section, still experiencing discomfort, but that may be just the scar and abs healing.
Yeah, good question. So a lot of the time, what I'll ask clients to in an assessment is, if you're reaching for something high up in a cupboard or you're twisting, do you feel like your range of motion is limited or restricted because of that scar? Do you feel like you can't turn or reach? Because of the scar, and do you feel that scar pulling? So that would be a bit of an indication that there is some scar tissue adhesions that we kind of want to break up, because it's obviously impacting your range of motion. And then just even like physically feeling the scar. So a lot of the time when I'm assessing a scar and palpating the scar, there are certain spots along the length of the scar that feel a lot more ropey and a lot more firm than other flatter spots. So those would be areas that I would usually tell people to kind of focus on, because we want to we want to break that up. We want to limit that those adhesions in through there. Would you agree, Kristen, with that?
Yeah, I think that's a perfect description. Here's another one. I've had my C-section 10 days ago. My organs all feel very loose. Will my abs slowly regain strength and support the organs? Question one. Is there something I should do just wear the abdominal support bands?
Great question. So the ab chat and all of that. So 10 days postpartum especially. So ab separation is something that normally happens during pregnancy. So the diastasis recti, the rectus abdominis do separate to support the growing baby, the growing uterus. That is something that's normal. 8 weeks postpartum is when ideally those abs should come back together. So especially 10 days postpartum, you're definitely well within that range of having the ab separation. Now, I do see a lot of women, and myself included, the abs don't always go back together at that 8-week mark, for a variety of different reasons. But they're muscles. We can always make change with muscle. The important thing is, strategy wise, you're not doing anything to perpetuate that separation. So, you're not doing things like, when you're lying down, kind of jolting up straight. You want to roll to the side and sit up, which I imagine you're doing anyways to protect the scar. So that's kind of a long answer to say the abs, natural healing, the abs will start to mend back together, but there are certain positions and postures that you should be doing to help support. And then also certain exercises to also help kind of mend the abs back together and get them back in a timely manner. And sorry, Chris, what was part 2 of that?
Is there something you should do, or just wear the abdominal support band?
Yeah, so again, as I mentioned with the study, the abdominal support is great, especially to help with pain post C-section. When it comes to, and again, if it's helping with pain, it's supporting you, and you're likely moving a little bit freer, which is also helping with your strength. Um, when you get into a little bit more active stuff, like kind of beyond that 6-week mark, I try to wean off those ab supports just to get a little bit more active core engagement. But they're definitely still a good tool to use and to use to support movements and lifting and stuff like that.
Great answer, Meg. Sorry, I'm just writing in the chat. It's the Your Choice Pelvic Floor Disorders Risk Calculator.
Oh, nice.
And, pardon me. There, you have a bunch more. So,
Oh, okay.
which is great. Love all
Yeah.
the questions. Where am I at? Scar adhesions. I was reading recently that the adhesions can attach to other muscles or organs around the area and can cause pain.
Yes, that is something that can happen. Now, there's 3 different styles of C-section cuts that the surgeon does. So a lot of the adhesion response and how deep adhesions can potentially go can also be directly related to the method of the incision. So it would, I know I'm not giving like a specific answer because it is very dependent on the mode at which the surgeon, what technique they used. But depending on that technique, there can definitely be some deeper adhesions that obviously some of the scar work would help with. I don't know if you know any more about that, Chris.
You know what? Honestly, I'd have to look that up a little bit more. That's not an area that comes up that often.
Yeah.
Great question, though.
Yeah.
Another one. I had an unplanned C-section a year ago and had no recovery instruction. I was very unprepared in June. I'm due again and considering a C-section, but very nervous. Yeah.
Very common, and it's one of those things that I hate hearing those stories when no one's given, education either prior or postpartum. And I know Chris, you see it. I see it all the time. Even back when I did orthopedics, when people would go in for their knee replacements or hip replacements, sometimes there's that lack of education on the postpartum end. So I'm sorry for anyone that's had that. It's just know that there are resources out there and there are people out there to support and please. And I know you're rightly so anxious for your next delivery, but I hope some of this helped, and know that you can reach out at any point in time if you have any like more specific questions. Yeah.
A couple more. Are you ready? Second part. Does the scar massage help break up the adhesions?
Yeah. So It's like with any, and I know I was taught this quite a bit in physio school, and just even in my early career dealing with a lot of hip and knee replacements. One of the first things you want to do is work on the scar to break up the adhesions so that you're not limiting range of motion. So, if a prime example that I use to tell people is if anyone's seen a knee replacement, the scar goes directly over the knee. It's a big scar. It crosses the joint line. It's an intense scar, and as soon as that's healed and ready, you want to start working on it so that the adhesions are broken up and that you're able to get that knee to flex as best it can without that scar limiting it. So, kind of a very long answer to say yes, scar massage does break up adhesions.
We've got another one. I may have missed this, but will the C-section surgery and incision and etc. impact ability to close abdominal separation that occurs during pregnancy?
Good question. And no, there haven't been any studies that show that there's a delay in ab separation healing for women that have had a C-section. So, from a diastasis recti perspective, vaginal deliveries or C-section, you'd still have the same protocol and in terms of things, positions to utilize and things to avoid. And your exercise to help mend the abs would be the same regardless of C-section or vaginal delivery.
Okay, great. We got one question and a follow-up to the previous question. Is there a wait period we should consider when getting pregnant again? I have to go through IVF and want to have a very nice womb for implantation.
So typically the magic number for that is 18 months from what I know, what gynecologists tend to recommend, OBGYNs tend to recommend that 18-month mark post C-section. Now, have women had babies closer together than that? Absolutely. But from a general healing kind of timeline perspective, making sure everything is as healthy and great as possible, that's kind of the ideal time frame, is that 18-month mark.
Okay, and a great comment from one of our participants providing some information. They're a physician and spend time in the OR. All intra-abdominal surgeries can cause adhesions, but for many people, these are asymptomatic.
Yeah, awesome.
Yeah, there are reasons you can be more likely to have adhesions, such as significant post-op infection. I'm not aware of any proven ways to decrease adhesions. And that's a great comment. Thank you so much for sharing. And it's interesting because we see so many women that have both C-section scars, but also maybe episiotomy or even tears that have been stitched up. And some develop so many adhesions and some really don't. And I think it's a function a little bit of your genetics and how you heal. And so that's a great comment.
Mm-hmm.
Is there anything that you would recommend, Meg, for muscle tears during pregnancy to minimize pain, burning, and discomfort upon movement?
Sorry, say that again.
Is there anything that you would recommend for muscle tears during pregnancy to minimize pain, burning, and discomfort upon movement? And I wonder if there could be a little bit of clarification. Let me just see.
So I was going to say that would be completely dependent on what muscle, what body part.
And maybe if Ivana's still on, are you referring to muscle separation maybe in muscle tears? I'm just not sure. Not sure if she's still here. I think she has left the, oh no, I see her still on. If you wanted to go back into the chat or even come off of mute. Oh, abdominal muscle tear. Yes. Upper right hand quadrant. There we go. Thank you.
Okay, so it was for
anything that you would recommend for muscle tears, abdominal, upper right hand quadrant during pregnancy to minimize pain, burning, and discomfort with movement.
So that would be, I mean, throughout an assessment, I'd get a better sense of it, but a lot of the strategies would be posture, position, effective breathing techniques, coughing techniques, those sorts of things. Again, if we're talking ab separation, that's something that is going to happen throughout your pregnancy. So we're not preventing that. We're minimizing it by not putting as much strain on those front rectus abdominis, but we're doing that by means of positioning and posture and good oblique work and lower TAs and stuff like that to support what those rectus abdominis muscles aren't able to do. So I'm not sure if that answered your question quite clearly, but.
And the other thing I would say, Meg, is, I mean, whether it's an abdominal strain or a tear or even lots of pain through the abdominal area, sometimes we are recommending abdominal supports
Yes.
in the pregnancy period,
Yes.
or people that have a lot of SI, so that
Yeah.
bone the back of the pelvis pain,
Yeah.
that sometimes too. So that's
Yeah,
another.
there's even yeah, that's a good point. Thanks for adding that in. Belly supports, and I even use some
Yeah.
KT techniques. So either for the belly to kind of help support the belly as you get a bit bigger, take the strain off the low back, or like you said, SI joint stuff. There's some different taping techniques to help support that to alleviate some of that strain and pain.
And just another great comment from one of our participants. You can always let your surgical team, including your anesthetist, know that you're nervous. There are different types of medications that can be used to help you relax, especially if you feel that you're very nervous at the time or just before the C-section. So great comment as well.
Yeah, that's awesome.
The questions and the comments across this group have been amazing. Thank you very much for making it so interactive. And thank you, Meg, for a really great presentation. I have recorded, I actually, with all the stuff happening at the beginning, I forgot for the first few slides, so we might have to record those, but I have most of it recorded. We do have a YouTube channel where we pop this up that people can come on and this and some of our previous presentations. And do keep watching on social media, because we're trying to get up timely information that's helpful for you. And if you have any other questions, don't hesitate to contact Meg directly or blueberrytherapy@gmail.com, and we can either funnel it to Meg or we can get you in to see a pelvic health physio. Thanks, Meg. Thank you, everyone.
Thank you, everyone. I really appreciate it.
Great.